Hi, my name is Matt Broadway-Horner. I'm the Clinical Director of CBT in the City Clinics. I'm also the Director of Mindfulness and the City Clinics as well, which is a side of the business which focuses on mindfulness-based CBT. And this has been proven to be quite successful for disorders like depression, stress, chronic fatigue and pain management. It's part of what's called the third wave of therapies, which is quite an exciting time in the world of CBT, which is looking at a different stance of looking at the mind and the thoughts with the way of moving forward to overcoming those difficulties. So it's led CBT to actually then bring about lots of other types of approaches within the field, like imagery and rescripting therapy, which is about looking at early life experiences, traumatic childhood bullying, that sort of thing, to look at addressing those issues with the possibility of rescripting some negative thoughts into more positive ones. So there's some quite exciting stuff that's happening at the moment in the world of CBT, and I'm glad to be part of that. My background is such that I've come originally from a nursing background and then retrained into being a psychologist. And looking at that experience, I've come from working from inpatient units, working with people with psychosis, right through to people who have self-harming issues, obsessive compulsive disorder, and a range of anxiety problems, along with depression and trauma. So that's taken me from the NHS through to the private sector, where I used to work for the Priory Hospital in North London, in their big cognitive behavioural therapy group programme there, and working with some big names and some specialists in the business. So I've learnt a lot from them, as well as my own work, and as well as working with clients. And the information I get from those clients has also been very valuable and has taken me forward to the point where I am now working for this company. Another aspect of the business is what we call the CBD in the City Schools Project. And this is a project that's really quite close to my heart because of the fact it's about delivering CBT to children. And we've been doing this with Year 5 and Year 7s with some good results. And it's been very encouraging to work with that particular age group. Now, we've been doing this for 3 to 4 years. And the reason why we looked at this is because we wanted to kind of bring in some aspects that would help people earlier on in their experience, rather than letting these problems fester and then developing into something more serious at a later date, which might be more problematic. Not impossible, but it's just more problematic. So here we are delivering training to teachers. So we'll have teachers in various set of workshops to learn about CBT and how to apply the CBT to themselves. And then we look at the lesson plan. So I have developed a lesson plan for the teachers to use. They are free then at the end of these workshops to then tweak it to fit their particular population. But they then roll out these lesson plans and then we evaluate them. And so we've had some really promising results in regards to looking at children who are able to be more self-aware, able to understand their emotions a bit more, able to understand their thoughts, which thoughts to pay attention to and which thoughts not to. So anger and aggression have all been considerably reduced in these schools, in these populations. So the teachers are more happy. They seem to have more time on their hands to do the more productive side of teaching, and the schools seem to be, or the classrooms seem to be more calmer and more easier places to learn. So that's been quite exciting to be part of that, and that's still ongoing. Another side that we've been looking at is working with people with learning disabilities, and I've been fortunate to work on a research project in delivering CBT to mild learning disabilities population in Camden and Islington. And the results there have been quite startling as well in helping people to overcome their depression and anxiety. Now, this typically has been a population which has been ignored by services because of the fact that they're learning disabilities. And one of the things that a lot of health professionals have said is, can they actually take on board such a structured approach? And we found that they can, and they do. And they've actually taken on board what they need to do in the therapy, and then they push it forward to overcome their difficulties. So a lot of these clients have benefited from that research and a lot from that particular approach. So looking at why I do this, I think it's about helping and empowering individuals to learn about themselves and discover how to manage difficult emotions. And it's quite rewarding for me to see that in front of me, working with these people, and it's a privilege to work with these individuals in helping them move forward. The various problems that I can help you with are as follows. There's a whole range of anxiety problems, so obsessive compulsive disorder, body dysmorphia, health anxiety, vomit phobia, and other anxiety problems like social phobia, a worry problem which we call generalised anxiety disorder, procrastination, low confidence, low self-esteem. Chronic fatigue is another issue that we address, and this often gets misdiagnosed with GPs and medics as depression, when in fact it's a little bit more complicated than that. So we can help with that particular problem. Chronic fatigue syndrome, it used to be known as ME, but now it's been renamed. The other issues that we can look at are anger, jealousy, hoarding. Hoarding is slightly different from obsessive compulsive disorder, but it is an obsessive problem looking at hoarding, and that can be very dangerous for the person, especially if they're hoarding huge amounts of stuff whereby they can't move around in the house. So there's lots of health and safety issues with that particular problem.